Don't let these 3 things slow down your medical practice growth. Here are some things you can do to be successful. The 3 symptoms right now that's really hurting your medical practice are the following. First, low reimbursements. That's going to happen more and more often now. Secondly, the trend toward value-based care. CMS, Center for Medicare and Medicaid Services, is really pushing that going forward, so you have to be prepared for that. And the third thing is, unfortunately, just a lack of time by the physician to help grow the practice. So how do you combat this? Let's talk about the first one, lower reimbursements. So try these strategies. First of all, do an audit of your medical billing. Here's some suggestions. Look at your accounts receivables to see if there are payments lingering. Sometimes you'll be surprised at how many thousands of dollars are just sitting there. Second, look at your ERA denials and see if you can file an appeal to clean them up. That's really key. Next, you want to also verify secondary payments and see if they are paying out. Sometimes from primary to secondary, there's a delay and you want to make sure they pay out in time. Also, make sure proper adjustments are made at the end of the month across the patient's balance to ensure you have a 0 balance. Most cases, you may be missing out on thousands of payments if you don't do this properly. So I have a doctor story. One time we had a client that did not post their payments in time. So what happened was when they finally posted it, they missed the Medicare 90-day rule. So if you don't post a Medicare payment in time, you're gonna have an issue with getting paid for timely denial. So you wanna make sure you post timely consistently so you don't run into that issue. Next, let's talk about value-based care and how that's hurting your practice right now. So fee-for-service was wonderful, right? You did a work, you got paid for what you did, and that was the rule of the land for years. But unfortunately, by 2030, most of your fee-for-service will be gone, especially for Medicare and Medicare Advantage plans. So the goal is to follow the value-based care trend. Whenever there's a wave, you need to ride that wave. Learn what programs are reimbursable. There's only a select few, but they're growing all the time. So get well versed in them. You need to learn how much you can get reimbursed for. For instance, there's several different programs. They have different ways and different processes to get paid. Understand how to implement them. In some cases, you may need to get a partner who can help you here because you just don't have the cycle, the time, or the staff to do it. But you also want to be wary of companies that come in and say they can do it for you, but they're going to capitate your rate, basically pay you less on a per patient basis than what you could have done on your own. So for instance, I have another doctor story. We had a client that was in rural Georgia that was looking to begin a chronic care management program or remote patient monitoring program, and they could have got hundreds of dollars per patient per month. But because it was difficult to get started, accountable care organization came in and said, hey, we'll do it for you. Don't worry about it, and we'll pay you this. Did you know that what they were going to pay them was going to be 1/3 of what they would have gotten on their own? So basically, they were going to give up all this revenue for someone to do work and maybe not do it as great as they could do it themselves. So be careful and wary of that. Don't let other companies come in unless you know what your rate is. But more importantly, if you do want them to bring on board, at least you can negotiate if you do it yourself or work with a partner that can help you get to that point so you can negotiate a better plan for you and your practice for the future. Hey everyone, I want to take the time to let you know how we can help you and your organization navigate the coming changes to your practices. Please join our monthly webinar on how virtual care programs will transform the management of your medical practice. In this informative webinar, you will learn our proven system on how not to miss out on any billable value-based codes, how to scale your team to handle new workflows without burnout, and the onboarding experience for value-based care programs that produce the best patient care. So if you want to learn more, click on the link below and sign up today. Finally, if you're a medical practice owner, or if you're a doctor owner specifically, it's difficult to grow your medical practice if all you do is see patients every day, right? So what do you need to do to be successful? We believe the key is to have the right staff in place. You need to understand your current staff's capacity and the roles they play. What are they doing now? Are they good at what they do? Do they enjoy doing it? In some cases, you may realize you may not have the right team now, and you may need to hire additional players. If you are hiring, my suggestion would be that bring on board a recruitment specialist, right? A great staffing company will help provide you with great qualified candidates that you can quickly onboard. Stay away from contingency-based recruitment, as that can end up being way too costly if the candidate doesn't stay on board. Having the right staffing agency can make all the difference in who you bring on board to be successful and continue to grow. Next, you want to start to document all the processes that your staff is currently doing. You want to create what they call standard operating procedures or SOPs around their duties. I've heard this quote, whatever you don't document will not improve. So you need to find a way to document their processes and what they're doing so you can improve upon it and learn from it. Finally, you want to record these trainings around the standard operating procedures. This training will help everyone get up to speed, but most importantly, when you hire new individuals, they can get up to speed quickly. Let me tell you another doctor story. One client of ours we were working with, they had a practice administrator who was responsible for new programs trying to grow the practice. Well, the doctor recently bought a new practice and wanted that practice admin to be over both practices. That practice admin had a lot of autonomy and they were doing a lot of different things. But over time, the doctor noticed, the doctor owner saw that they weren't getting the payments that they should receive from reimbursements, or the programs weren't growing as fast as they thought they could. Well, guess what? They found out that this practice admin was working a second job. So not only were they managing both practices for the doctor, but they were working a second job at the same time. And the doctor found that out. That's why they weren't able to grow. So you want to make sure you have the right people who have high integrity, but more importantly, going to get the job done, and you need a way to manage them properly with your standard operating procedures. The pain to replace that person took 6 months and cost the doctor owner tens of thousands of lost revenue dollars. So you don't want to be that way. You want to think about how you hire people and bring them on board. So let me know in the comments below if you think these tips are extremely helpful and can help you grow your medical practice. As always, subscribe so you don't miss future valuable healthcare business tips as we navigate this new normal together.